pleasure to be here today to welcome you to the award ceremony. And today I'm here to present EASO's New Investigator Award in Childhood Obesity. I'm Jennifer Baker, and I'm a co-chair of the Childhood Obesity Task Force. So on behalf of myself, EASO, and my task force co-chair, Jens Christian Holm, it's my pleasure today to present Dr. Sofia Ramalho from the University of Minho in Portugal with this year's award. Dr. Ramalho was chosen in recognition of her contributions in the field of psychology and obesity. Her work has led us to a greater understanding of how to enhance healthy eating behavior in adolescents undergoing obesity treatment. Additionally, she's worked with maternal eating behaviors and children's eating behaviors, especially in children who are undergoing obesity treatment. So today, I look forward to learning more about the great work that Dr. Ramalho has already performed and potentially about some of the work that she will also do. So now I would invite you to share some of your work, please. Thank you.
Thank you. Thank you, Professor Jennifer, for the nice words and presentation. I will just share my screen. Just a moment. Wait. Okay, can you see? Yes. Okay. So first of all, I would like to thank EASO for this prestigious award, and I'm really thrilled with it and with the opportunity to present some of my current work about eating behaviors in children and adolescents with overweight and obesity, and mostly to talk about my work with new technologies, namely social networks and Facebook, to optimize the pediatric obesity treatment in public healthcare facilities. So, my work in technological innovations in the treatment of adolescent overweight and obesity is based on the premise that public healthcare services often lack the human and economic resources to implement and offer multidisciplinary interventions as a standard approach to pediatric obesity. In this context, interventions based on internet and online applications such as social network, namely Facebook, can be an attractive, low-cost alternative that has demonstrated the ability to change behaviors related to a healthier lifestyle. To our knowledge, at the time that we developed the APOLO-Teens intervention in my PhD, there was no web-based interventions designed for this population using Facebook. So in the next slides, I will briefly describe the APOLO-Teens web-based intervention and its results. This intervention is a 6-month cognitive behavioral lifestyle program that was designed to be delivered through Facebook and aims to promote a higher consumption of fruits and vegetables, increase physical activity levels, and decrease sedentary time, ultimately to facilitate weight loss and compliance with the treatment as usual recommendations in public healthcare facilities in Portugal. It comprises 3 main components. First of all, a manualized intervention implemented via Facebook private groups, which includes psychological weekly videos with cognitive behavioral therapy strategies and daily images and posts. We also have chat sessions with monthly chat sessions with a trained psychologist. And here you can see the interface of the intervention in Facebook. The last component of the APOLO-Teens web-based intervention is the weekly self-monitoring system. This is an app and a web application that provided participants in APOLO-Teens with automatic personalized feedback messages assessing their hours of physical activity, sedentary time, and consumption of fruits and vegetables each week. This intervention efficacy was tested by a randomized clinical trial with two groups, the control group that received the usual treatment for overweight and obesity in a hospital setting in Portugal, and the intervention group that in addition to the usual treatment received also the APOLO-Teens intervention. This intervention was targeted to adolescents with ages between 13 and 18 years old with overweight and obesity. The study protocol and the baseline characterization are published, but in short, these characterization help us to understand a little bit more about the environment that surrounds these adolescents, as well to get more information about their eating practices and patterns. In particular, girls seem to demonstrate more psychological distress, higher impulsivity, lower physical activity, and also a lower health-related quality of life, suggesting that girls may require additional clinical attention regarding the intervention format. The paper about the feasibility and effectiveness of APOLO-Teens is still under review. We're still working on this data, but preliminary analysis help us to understand that APOLO-Teens was feasible for this population, and two-way mixed ANOVAs showed that both groups, the intervention group and the treatment as usual group, improved their vegetables and consumption, and also decreased the consumption of pastries and cakes, decreased their depressive symptomatology, their grazing eating behaviors, and also their BMI score at the end of the 6-month period. Particularly, the APOLO-Teens intervention group showed a significant increase on fruit consumption per week. They start to consume about 2 pieces of fruit per day, and before the intervention they were consumed about 5 to 6 per week. We also observed that when we analyzed the high adherence group to APOLO-Teens, the group that visualized more videos, that interact more with the intervention, they showed better outcomes when compared with treatment as usual regarding fruit vegetables consumption, but also regarding their the lower levels of depressive symptomatology, and also less frequency of problematic eating behaviors such as fear of getting fat and grazing eating behavior. Currently, most of my work aims are related to the link between pediatric obesity and eating behavior, since these two concepts are often conceptualized and examined separately. In this regard, we explored several eating behaviors, since the problematic eating behaviors to the adaptive eating behaviors. Grazing eating behavior is a problematic behavior that can be characterized by eating in a repetitive and unplanned way between meals throughout the day. This behavior is associated with poor weight management and obesity in adults. Nevertheless, research about this eating behavior in adolescents with overweight and obesity is limited, and there were no valid measure to assess grazing in this population. Thus, we successfully validate it as a valid measure to assess this behavior in adolescents with overweight and obesity. And most importantly, our findings, our preliminary findings about this behavior indicated that in pediatric obesity, grazing seems to occur in the context of adolescent impulsivity, psychological distress, lower quality of life, and together with other disordered eating behaviors such as fear of getting fat and food preoccupation. In the other side of the spectrum of eating behaviors, we try to find some behaviors that could be protective or positive, and that could help to enable pediatric weight loss interventions. In this scope, we explored the intuitive eating concept that can be characterized by the reliance on the individual's anger and satiety cues to decide when, how, and what to eat. Our findings, this is still a work under review, indicated that the intuitive eating scale was appropriate to measure this concept in pediatric obesity, but most of all, correlation analysis showed that higher levels of intuitive eating were linked to low levels of grazing eating behaviors, lower impulsivity, less body image dissatisfaction, less depressive symptomatology, and to a higher quality health-related quality of life, suggesting that intuitive eating may be a part of a healthier psychological state. Now, backing a little bit to the problematic eating behaviors, we focused on this final work in children undergoing weight loss treatment, and we tried to identify maternal eating behavior profiles. Three distinctive disordered eating profiles emerge of maternal profiles, and these profiles seem to be associated with specific problematic eating behaviors of children undergoing hospital weight loss treatment in Portugal. In fact, children of mothers in the disordered eating cluster had significantly higher emotional overeating when compared to children of mothers in the other two clusters, namely the restrained eating and the low disordered eating cluster. So this is a new finding, an interesting finding about the relationship between maternal eating behaviors and maternal variables and problematic eating behaviors in this specific population. So, in conclusion, we believe that this work contributes to increase the current knowledge about the link between eating behaviors and pediatric obesity and highlight the use of new technologies in the treatment of childhood obesity. But there is still a lot of work to do, and regarding the link between eating behaviors and weight loss treatment trajectories in pediatric obesity. Finally, I would like to thank to my research group, to our founders and collaborators, and again to EASO for the award. Thank you all for listening.
Thank you, Dr. Ramalho, for that really lovely presentation. I think it nicely demonstrates the really impressive body of work you've achieved. And it's such a great pleasure to be here today and give you the award in recognition of this.
Thank you.
Hearing your talk, of course, it raises many questions. And we would really like to know, with this knowledge that you've gained, how are you going to apply the next steps of your research program? Where are you going next?
Currently I work as a postdoctoral researcher in a project related with pediatric obesity also. And now in the future, and we are already collecting some data, we are trying to explore neurocognitive correlates of problematic eating behaviors. And so this is a new variable that we are looking for to explore in the future. And also we are trying to test the feasibility of APOLO-Teens, the web-based intervention, as a family Facebook intervention for this population, since we understand the importance of parents in the intervention and in pediatric obesity treatment, and we aim to use social networks to engage them also in the treatment and help aiming to improve the current results of this approach. So in the future we will be very busy with these variables and with this work.
Well, again, a very big congratulations from EASO, myself, and of course my co-chair of the task force. So congratulations, and we look very much forward to seeing your work in the coming years. Thank you.
Thank you, Professor Jennifer.